So my name is Meaghan Johns. I am the clinical director for our Care Transitions team for Network for Health. Care Transitions is a team of clinicians who are looking to work with individuals at points of transition. So the three transitions that we've targeted are individuals who are coming out of the House of Corrections, so Hillsborough County House of Corrections and Rockingham County House of Corrections, back to the community. We are also working with individuals who have been in an inpatient hospitalization, so either medical or psychiatric, and are ready to go home and are coming back to the community. And then we are working with transition-aged youth, so youth who are currently being served by a youth-serving behavioral health system and are transitioning into adult services. So those are the three transitions that we're working with, and the intervention that we're using with these individuals is called critical time intervention. So critical time intervention, or CTI, is a 9-month intervention, and it is designed to be, it's a case management model, but it's different than a traditional case management because it is a time-limited and phased approach. So CTI, we only work with folks for 9 months. So in traditional case management, you kind of work with someone until they don't need you anymore. We set this up from the beginning that you only get us and our assistance for 9 months. And when we say a phased approach, we work with individuals at different intensities based on what phase they're in. So 0 to 3 months post-transition is our phase 1, and then 3 to 6 months post-transition is phase 2, and then 6 to 9 is phase 3. And the intensity varies based on client need, but also what phase they're in. So in phase 1, we might see someone 2 to 3 times a week, and really we're trying to, in that phase, it's really intense. We're connecting someone to behavioral health care, we're connecting them to primary care, to housing benefits, to supportive services, to substance use treatment. We have them help them apply for Medicaid, help them apply for food stamps. And then as people start to get established with their outpatient care, we start to then pull back. And so in phase 2, we might say we were seeing someone 2 times a week, we might pull back to once a week. And then so on and so forth. It's very individualized. There's no cases, there's no prescription that says this is how many times we can see someone in CTI. It's really individualized based on client need. The caveat to that is that the time clock for the 9 months starts the day of the transition, and I can't stop it, I can't pause it, I can't restart it. So unlike traditional case management where someone might move through phases of care based on readiness to move or preparedness, this is just by the calendar. So when you hit 90 days, you got to go into phase 2. And when you hit 180 days, you got to go to phase 3. Say you end up back in the hospital for a short period of time, I can't stop the clock, so the time keeps ticking. We really want to try to work with people as close to their transition date as possible. So we're really encouraging community partners, hospitals, jails, providers in the community. If you have someone that you're working with and they've just gotten out, they're at a critical transition, they've just gotten out of jail or they've just gotten out of the hospital, call us as soon as possible. If you're working with them inpatient, like if you are at New Hampshire Hospital or an inpatient unit and you know someone is going to have transitional needs, we want them to call us as soon as they know, because we'll start working with them before they leave. We like to be a part of the discharge plan. We always say we're part of it. We're not the discharge plan, but we'd like to be part of the discharge plan and talking with somebody about where are you going to go when you leave here and what types of services are you going to need, so that we can start to help establish some of those appointments before they're discharged to the community. We'd like to work with folks before they leave or before their transition happens. But the reality is that doesn't always happen, and that sometimes somebody gets out of the hospital and a week later, somebody else walks in and says, oh, this person could really benefit from this service. Call us anyway. We try to keep it within 2 weeks of transition, but 16 days, 17 days, we can be flexible. We kind of review everything on a case-by-case basis. So it's definitely worth giving us a call and seeing if somebody's eligible. Our eligibility criteria, aside from having to be at a point of one of our 3 critical transitions, you've got to have a behavioral health disorder, so either some sort of psychiatric diagnosis or a substance use disorder. And you've got to have Medicaid or be Medicaid eligible. And then we're really looking for folks who have functional impairment need. So folks who need help with transportation, or they lack resources, or they have unemployment needs, or aren't connected to behavioral health, or need help connecting to a primary care, or have an abundance of kind of comorbidities around lots of medical needs and need specialty care. Those are the folks we're really looking to capture. Just because you're at a transition doesn't necessarily mean you need transitional help, so we look at functional impairment as well. So we've been getting referrals from lots of places. Different hospitals tend to be our number 1 referral source. They call us a lot. But hospitals, jails, the kids department here at Manchester Mental Health upstairs, they've sent us some referrals down for some kids who are transitioning into adulthood, so that's exciting. That's really kind of what we're doing, and our goal is at the end, at the end of the 9 months, we hope that you don't need us anymore. So we really want to take someone who is here and they've got, all these needs, and we walk the walk with them. We'll connect them to the resources that are appropriate that already exist in the community, so that at the end of 9 months, you don't need me anymore. You've got care that's established by long-term providers.